Okay, and just real quickly, so the first item on our agenda is just a reminder for public comment. So no action may be taken upon a matter raised under public comment period, unless that matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin with stating their name for the record and spelling their last name, and provide 1332 waiver program at nbha.nb.gov with written comments. We'll include that in the chat. Comments must be provided up to and included the day of the meeting by 5 p.m. for inclusion on the record. So I'll pause there for a minute for any current public comments. Okay, I'm going to pass it over to our presenters.
Thank you so much, Rose. Welcome everybody this afternoon to Nevada's 1332 Waiver Public Update Forum. My name is Jennifer Krupp. I am the administrator of the Division of Consumer Health Services. I'm joined today by Adam Plain, our agency manager over the Public Option Program, as well as Rose Sutherland, our chief over the Public Option Program. And is there anybody else in the room, Rose?
There is also Tanya Lindesma. She is one of our social services program specialists. We also have Lynn Beaver, a management analyst, 3 on the meeting as well as a part of our team.
Wonderful. Thank you so much. We're going to start today. Next slide, please. Thank you. So the agenda today is to convene a public forum to share updates on the progress of Nevada's Battle-Born State Plans and Market Stabilization Program under our approved 1332 waiver application, and to gather public comments. Again, the purpose of today's forum is to provide the public an opportunity to provide meaningful comment on the progress of the waiver and, like we said, to gather public comments. We'll talk today about the progress up to date and opportunities as we're moving forward. We'll also take time to specifically collect public comment on the waiver program, the public option program, and then we'll talk about some next steps. There will be another opportunity to provide public comment at the end of this presentation for any public comment that is not specific to the 1332 waiver. So thank you so much, and we'll go ahead and go on to the next slide. So in 2021, Senate Bill 420 passed, which was codified into NRS 695K, which established the public option program, now known as the Battle-Born State Plans. This bill directed the state to apply for a 1332 waiver under Section 1332 of the Affordable Care Act, hence the 1332 waiver title. You'll hear us refer to the waiver as the 1332 waiver, the reinsurance program, as well as the market stabilization program. Those 3 terms do tend to be utilized interchangeably. On December 27th of 2022, Nevada had submitted its final 1332 waiver application for federal review and approval, and we had to meet certain federal guardrails for affordability, comprehensiveness, coverage, and budget neutrality for the federal government. We'll go into those topics here in just a moment. On January 10th of 2025, Nevada did receive final federal approval of its 1332 waiver for a period of 5 years, which begins with plan year 2026. Plan years run on a calendar year basis, so January 1st, 26 through December 31st of 2026 is our first plan year. The total waiver period is January 1st through December 31st of 2030, with the option of a 5-year renewal. Next slide, please. So in Nevada's 1332 waiver, we requested federal law be waived to implement the following provisions. We instituted a premium reduction target for the new Battle-Born State Plans, and we created and implemented a state-based reinsurance program. This reinsurance program and the premium reductions have begun in plan year 2026. And with the reinsurance program, payments will be determined at the end of plan year 26, with payments to carriers to be anticipated early to mid-year plan year 27. Through the premium reduction target, Nevada saves the federal government funding with respect to the premium tax credits used in the state's exchange, which is NevadaHealthLink.com, also our ACA marketplace, to buy down the cost of health insurance. This savings is passed back to the state as federal pass-through funds. And so these savings really are constituted from the subsidies that are paid to consumers on the exchange who purchase their coverage on the exchange. So under the approved waiver, Nevada will reinvest these new federal funds into the state's market stabilization program, which includes the state-based reinsurance program. One of the things to mention too is that these savings will be felt market-wide as reinsurance payments are available to all licensed carriers in the individual market. So this is not restricted to only the on-exchange plans in the individual market. Next slide, please. So we're going to provide an overview of the Battle Born State Plan. So state law requires that the director of the Nevada Health Authority contract with carriers to offer public option plans in coordination with the state's Medicaid managed care procurement process. These plans are referred to as the Battle Born State Plans, and they must meet all federal requirements for qualified health plans offered on the state's exchange. It's the Silver State Health Insurance Exchange is the state's agency name, but the plans are sold on NevadaHealthLink.com. That is the platform where consumers can purchase these plans. So for the first year of the plan for the Battle Born State Plans, we have 3 carriers, and there's 8 carriers total on the marketplace. But the 3 BBSPs are Anthem, which is also known as Community Healthcare Plan of Nevada, Silver Summit, which or Ambetter, and then Health Plan of Nevada, or HPN. The plans, BBSPs, have all 3 metal levels required, so they have at least 1 bronze, 1 silver, and 1 gold Battle Born State Plan, and they must offer 1 non-BBSP silver qualified health plan for sale each year in the individual market. For plan year 2026, all BBSP silver plans did meet their annual premium reduction target is 3% required by state law. So under NRS 695K, carriers offering the Battle Born State Plans are required to satisfy a premium reduction target or a trend rate on their silver plan. Over the course of the entire waiver period, that will be 15% lower than the average reference premium by the 4th year, which is plan year 2029. So for plan year 1, the first plan year, BBSPs had a premium reduction target of 3%. That percentage will change each year as the director establishes a new premium reduction target. So these premium reductions ensure that carriers offering the public option plans, or the BBSPs, do reduce premiums over time. And to implement these premium reduction targets, the state has required that plans meet 3% this first year, and this target will increase cumulatively over the next 4 years to meet the total 15% reduction. Next slide, please. And this is where I believe I will pass it to Adam, who's going to talk. Go ahead, Adam.
Thanks, Jennifer. So a couple of other unique Battle Born State Plan requirements that we want everyone to be aware of. There is a provider participation portion of this law that went into effect. Under the provider participation portion, in order to be eligible to contract with the state's Medicaid managed care companies or with the state for Medicaid fee-for-service, or to contract with the state through the Public Employees Benefit Program, or contract through the Workers' Compensation Program, you must participate as an in-network provider with at least 1 Battle Born State Plan carrier. That requirement, the statute went into effect on January 1st of 2026. The Nevada Health Authority has waived the requirement for the first year of the program, so January 1 through December 31, 2026, as we get that implemented. And we do have a copy of the waiver notice posted on our website, which is nvha.nv.gov. Additionally, or for providers who are contracted with the Battle Born State Plan program, providers have to accept new patients enrolled in the battle-born state plans. To the same extent, they accept new patients in other commercial health insurance plans. So we're looking to prevent just someone enrolling in a network and then immediately saying, we're not accepting patients. That doesn't do consumers in the state any good. We also have a provider reimbursement provision in the public option law in NRS 695K. Anticipating that there may be a fear that reimbursements to providers are reduced, the law requires that reimbursements to providers for specific procedures or benefits cannot go below a floor rate, and that floor is the Medicare reimbursement rate. Based on our information and the rate filings for plan year 2026, we would state that the 3% premium reduction in the battle-born state plan program was achieved for all carriers without reducing reimbursement rates to contracted providers. The state has worked with our BVSP insurers to currently reduce administrative expenses and not have the entire burden of reductions land on the feet of the providers. Next slide, please. So in addition to the battle-born state plan program, the other part of this is our state's market stabilization program. The market stabilization program is really designed to mitigate risks of the premium reduction target on health carriers and their networks by reimbursing them for a portion of the claims that they experience. We want to reward our partnered contracted health insurers and their networks for improving health outcomes and quality of care. We want to try to ensure additional stability with new options and market reforms. And we're also looking to address significant gaps in Nevada's healthcare workforce. So we're looking at 3 specific programs to achieve these goals. The first is the state's reinsurance program that is operational for plan year 2026. The reinsurance program operates by utilizing the pass-through funds that the state receives from the federal government to reimburse the health insurers in the individual market for claims that their members incur. It starts at the first dollar of claims that are submitted for each individual member. The state pays 4.4% of those claims up to about $1 million per individual member, at which point there's a federal program that kicks in and takes over those. The state is implementing a quality improvement payment program.
Do you hit the next slide?
No. Which is the incentive program we discussed. And then there's also the Practice in Nevada program, which is designed to induce providers to come to the state through like a loan repayment program. So now if you want to move to the next slide, please. So this has some additional information about those programs we just discussed. The state reinsurance program. I want to reiterate that state-based reinsurance program does apply to all insurers in the individual market, regardless of whether they're offering battle-born state plans or not, whether they're on the exchange or not on the exchange. That is a market-wide program. The quality incentive payment and the Practice in Nevada program are designed to kick in once the pass-through funding is sufficient to fund those additional programs. So there's no commitment on the state's part until additional funding becomes available. And then the fourth item we've got on here is the premium relief program. You see the note says it's for individual market enrollees who experience unavoidable increases in premium costs due to the introduction of battle-born state plans. That's a program that the state has implemented in coordination with CMS because of the way the exchange market works, where consumers can automatically re-enroll from one plan year to the other. Changes in their tax credits that they receive might affect their initial out-of-pocket premium costs if they re-enroll and don't actively shop. And so the premium relief program is designed to mitigate some of those costs for those consumers. So if you want to move on. Here, Jennifer, I'll toss it back to you.
Thank you, Adam. So for the 1332 waiver progress and updates for year one, the battle-born state plans plus the reinsurance program for the BBSP carriers did reduce the average premium rate trend by 7%. These are on exchange plans. And then the average consumer premium cost was reduced 5.3% across all 4 rating areas. We have this chart here. This chart has been shown before. This chart represents the second lowest cost silver plan with the waiver, without the waiver, and what the total rate difference is for each of the 4 rating areas here in Nevada across, or for plan year 2026. And so you can see that rating area 4 had the highest rate reduction, whereas, rating areas 2 and 3 had the same rating area reduction. So that's where we get that 5.3% across all rating areas. Across the total individual market, the average total or gross premium for consumers is about 4.7% less or lower than what the market would be without the waiver. And then the out-of-pocket or the net premiums for consumers is about 4% lower than it would have been without the waiver. The reason for this difference is, as many of you are aware, the subsidies did change beginning in plan year 2026. So those COVID era or those enhanced premium subsidies did expire beginning in January. And also the other thing to note is that battle-born state plans were new plans to the market for plan year 2026. So they didn't have automatic re-enrollments into those plans. And premiums are based off of the cost of the second lowest cost subsidy. So due to some of those market shifts, that's why we did see a lower premium impact or reduction impact on the net premium for consumers than we did for the total individual market. And at the close of open enrollment for plan year 2026, battle-born state plans were roughly 10% of total enrollment on the exchange. The exact number was, I actually wrote it down over here, 10,762. And I will pass it back to Adam to move into the next slide, which is looking ahead.
Thank you, Jennifer.
You're welcome.
So looking ahead, we talked a little bit about the programs in the market stabilization program and what they're comprised of. Really wanted to touch again on how the market stabilization program is intended to function on a go-forward basis. So as the state receives the federal pass-through funds from CMS, that's going to go to fund the premium relief program first. The premium relief program, like I mentioned, is designed to offset some costs for consumers based on their enrollment activity. What's very important to note is there are some fairly strict parameters on the premium relief program as agreed to by CMS and the state. So for example, you have to have been enrolled in an exchange plan on December 31st of 2025. You have to remain enrolled for a portion of the 2026 plan year. And any payments under the premium relief program are scheduled to be prorated based on your enrollment. As I mentioned previously, it's kind of designed to encompass those scenarios where someone automatically re-enrolled, didn't actively shop, and maybe their tax credit amount was changed. So if you weren't enrolled in a plan in 2025, then you weren't automatically re-enrolled. If you re-enrolled and gained coverage through some other source partway through the year, then that automatic re-enrollment activity didn't harm you for the entirety of the year. And so that's why some of those parameters under the premium relief program exist. But once the pass-through funds are used to fund the premium relief program, the remainder spills over to the state reinsurance program. The slide has the same parameters that we've kind of discussed. The thing to note here is the state is anticipating making payments for the 2026 plan year in around mid 2027, depending on when certain information becomes available from the federal government and CMS on eligibility for those claims. Once the state reinsurance funds have been paid out, any excess is intended to spill over into the quality incentive program. Then carriers who meet the quality incentive program parameters are eligible for those payments, and additional funds left over then spill into the Practice in Nevada program, which the state can use to fund those loan payment programs. Now, because this is a new program just starting in its first year, it's not anticipated that there will be excess funding to spill over into the quality incentive program or the Practice in Nevada program. But based on the state's modeling, it is anticipated that funding in future years will be sufficient to fund those programs. So that's the end for that slide. So that's the recap of the Battle-Born State Plan program for its initial year of 2026. As Jennifer mentioned, this is a forum to solicit comments. So we've provided this information to provide context around the program. We encourage anyone that has comments, questions, feedback about the program to contact us at the listed email address, which is 1332waiverprogram@nvha.nv.gov. Our request is please include, post-award forum or something similar in the subject line so we can differentiate comments related to this forum from any other comments that we may receive to that email address. We do have our comment period for this forum open through June 30th of this year, so through the end of the month. So if you want to submit comments or feedback, please do so by that date.
I'm gonna pass it up to me.
Well, Jennifer, do you have anything you want to add?
I'm also going to note too that we can accept verbal comments in this forum as well. So if anybody is online or on the phone lines and wishes to provide public comment on this matter, which is the public forum for the 1332 waiver program, we're happy to accept those public comments now. If people choose to submit their comments in writing, we will accept them through June 30th of 2026. That's all I have to add.
So then we'll throw it out there. If anyone has comments, specific to the forum, the contents of anything discussed here during the forum today, if you want to raise your hand to share those verbally, feel free, and we'll monitor that.
I'm not seeing any hands raised.
I'm also not seeing any.
Oh,
We have Suzanne.
unallow their mic.
Hi, yes, hi, thank you. I'm just curious, do you know the difference or what the numbers were for the silver, the regular silver plan versus the Battleborn silver plan? As far as numbers?
Can you,
Um,
clarify your question a little bit, Suzanne? Like numbers, what
I'm
numbers?
sorry,
you're
yes. So, do you know what the enrollment rate was as far as just the second lowest silver plan versus the Battleborn state plan, what the difference is in enrollment with those two?
we can get you that number. I don't have it off the top of my head or in my notes here. Total exchange enrollment ended at about 110,000 for plan year 2026. And so we had about 10% of all enrollees were in Battleborn state plans. But if you're looking for specifics in terms of which actuarial value or which metal level consumers enrolled in for BBSP versus non-BBSP, we can pull that data and get it to you.
I'm just curious to know because I know there was some questions about the Silver State plans and accessibility and everything else. So thank you. I appreciate that.
You're welcome. Thank you. And do you mind stating your full name for the record, please?
Suzanne Durante.
Thank you.
Thank you.
Sure, something. She submitted via email too, just in case.
Is there anyone else that wants to make a comment or anything? Okay, I'm not seeing anyone else raise their hand. So we'll go ahead and close the comment on the forum for the time being. Again, if you have additional comments and you want to follow up in writing, please do so at the email address listed on the slide. We intend to have the slide deck and recording posted just as expeditiously as we can. Rose, other public comment? Toss it over to you.
Yeah, so if there are if there's public comments regarding any other issues, again, this is just a reminder, no action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin by stating their name for the record and spelling their last name and provide 1332 waiver program at mbha.mb.gov with written comments. So comments must be provided up to and including the day of the meeting for inclusion on the record. So if there's any public comments regarding any other issues, if you could please let us know now, that would be great. Not seeing anything. I think we are adjourned.
Yes, so not seeing any additional comments, we will go ahead and close the meeting today. Thank you very much for your attendance, everyone. And like I mentioned before, submit anything in writing to the 1332 waiver program email box.
Thank you.